Examination to the ways our community is working to reduce fatal overdoses and get people with substance use disorder into treatment.
Tonight, we focus on harm reduction, a method aimed at keeping people alive long enough to reach recovery. As Leanna Scicchetti shows us, the efforts in Roanoke have helped hundreds of people to live to see another day.
These days in Roanoke, hope comes in the back of a van.
This is a dose buster.
A van stocked with supplies and compassion, with a woman at the wheel who knows a thing or two about second chances.
Most of the time we have everything that we need.
Courtney Downs is a peer recovery advocate at the Virginia Harm Reduction Coalition in Roanoke City.
So this is the nasal.
After a lifetime dotted with substance use disorder, she's found recovery and a purpose.
I would say one of the best parts of recovery is just discovering myself and who I am, and being able to be vulnerable.
That vulnerability means sharing her story, all of it.
I had to go through hell and find my way out in order to go back in to help pull people out.
Downs found recovery once before and a career as a nurse, but a back injury led to narcotics, which reawakened her substance use disorder. Addiction took hold of her and everything she had.
I have a saying that I wasn't just burning bridges, I was torching towns,
When I reached out to Courtney about this story, I didn't realize we'd actually met once before. So to show you just how far she's come in her recovery process, I wanted to bring you back to the place I first met her on a bitterly cold night in 2018 when she was living under this bridge.
I showed her the story she appeared in almost exactly 5 years ago.
Those were really hard times back then,
Downs says during the pandemic, a compassionate judge led her to a jail with a therapeutic care program and a second chance. But she might not have gotten to that point without the help of a stranger in a motel who revived her from an overdose.
At that time in my life, I think I just wanted to die. I look back, though, and I'm so grateful. That man was like an angel.
Her boss will tell you that the angel came bearing the fruits of harm reduction.
We know this is happening, and we just want to keep people alive until they can get the help that they need.
Danny Clausen is the director of the Virginia Harm Reduction Coalition. Since 2018, the coalition has worked to fulfill that mission in several ways.
Here's CPR masks.
From the van, Downs and other peer recovery advocates distribute naloxone, the opioid overdose reversal drug. They offer case management and connection to services like food and housing, handing out clothes and hygiene kits. But they might be best known for distributing supplies like clean syringes to help prevent the spread of HIV, STDs, and hepatitis, as well as other life-threatening illnesses like endocarditis.
And so what we're really about is trying to break that mold of stigma, shame, rejection, isolation, and say, hey, you're a human being. We love you.
Clausen said in 2022, the Virginia Harm Reduction Coalition served more than 1,500 clients. Those clients were given 19,000 doses of naloxone, and over the year, they reported more than 1,000 overdose reversals.
And I think people are willing to look at new solutions and follow the evidence, because what we've been doing for the last 100 years, it's just not working.
Clausen said they've also worked to vaccinate hundreds of participants against COVID, hepatitis, and the flu, and they've helped lead 31 participants to treatment.
I have more conversations about recovery, than I do about active drug use.
In between serving clients,
we hold Narcan in there.
Downs prepares clean use kits and hygiene supplies to distribute on the van while collecting data from participants. Statewide, the Virginia Department of Health reports more than 6,000 clients have been enrolled in the Comprehensive Harm Reduction Program since 2018. And these clients have reported more than 3,400 overdose reversals.
When people ask, what is harm reduction? Harm reduction is love.
Right here is tampons, pads.
But the work of Clausen's team can only go so far to push back against the avalanche of substance use disorder in the region. There are just 3 harm reduction units authorized to operate in Southwest Virginia. They continue to battle the onslaught of potent fentanyl and other synthetic drugs naloxone can't help. Not only that, but Downs says the community needs more resources like housing to support stable recovery.
You look at Maslow's hierarchy of needs, right? And if that basic, human physiological needs are not being met, a person cannot practice higher levels of functioning. If they're in survival mode, it's impossible.
Despite the uphill battle,
So just so you can see that?
she's buckling down, committed to the delivery of hope.
There are a lot of people that wrote me off a long time ago. You never know who they can help one day. Maybe one act of kindness or, compassion can make a difference.
And Leanna joins us now. Leanna, that's an incredible story. Courtney's story is proof that harm reduction works.
Yeah, and she is saying essentially they want everybody to carry naloxone, even if you don't personally know somebody who is struggling with substance use disorder. Danny Clausen mentioned that she's had friends go to the gas station in the morning, get a cup of coffee, fill it before work, and see somebody having an overdose, and they didn't have naloxone with them. So I actually have a case here. This is what it looks like. There are instructions on the front.
How much does it cost? And they want everyone to have
They
this.
want everybody to have this. Keep it in your car, keep it in your purse, because they say you never know if you have an opportunity to save a life. You can contact the Drop-In Center, Virginia Harm Reduction Coalition. They also offer training services as well, the Revive training, so you know how to use it. Now, this only works if somebody is overdosing on opioids, but we're also seeing synthetic drugs also come into the market that interfere. So some people may need more than one dose of this, but yes, they're trying to get the word out to let everybody know what it does and how it works, and so everybody can carry it. They're trying to also bring harm reduction into the Piedmont area. They say Martinsville is only about 13,000 people, but has the same overdose rate as the city of Roanoke.
Yeah, okay. That's some scary stats, but good information for everybody to know about that. Thanks, Leanna.